So good evening, everyone. It's a good snowy night for a Zoom webinar from Valley View. I am Dr. Betsy Brew. I'm a breast surgeon here at Valley View, and I have the pleasure of being here tonight.
Well, it's my pleasure. I'm Pete Rossi. I am a radiation oncologist at Valley View Hospital and lucky to be a colleague of Dr. Brews. And we're both members of the breast care team here. And thank you for joining us this evening.
And this is the, believe it or not, it's the 9th webinar that we've done. We started in last July. And I'm hoping people have had a chance to watch. If not, you can see the videos again on the Valley View website, or I think on YouTube. But if you have watched, I'm hoping you're getting the sense that we all have a really collaborative effort here. And the fact that we're finishing with the two of us sitting together just again demonstrates the strength of the program and how we do work together. And now you can see it for yourself.
Yeah, absolutely. It's interesting. It'd be nice real quickly just to run through the topics we covered up to this date, just to show you what we've done and to show you what you can access online, because I think that's a big part of it.
Good, and I can do that. And then also this will be casual. We're going to kind of ask each other questions and we'll answer each other's questions and answer our own questions probably. But while you're watching, there is a Q&A button on the bottom of your screen that you can also jump in and ask questions.
Yeah.
So this being the 9th, the previous webinars, the first one was last July, believe it or not. And in that one, I started out talking about breast issues that weren't breast cancer. So kind of a broad scope of non-cancer benign breast issues. And then in August, Dr. Weathers and one of the mammography techs here, Becky Williamson, did a discussion of mammograms, set up sort of 5 mammogram myths. And I'm hoping everyone remembers now the importance of doing mammograms on a regular basis. And we'll probably talk about that a little bit with survivorship. In September, I joined the 2 nurse navigators here we really sequentially went through a woman's journey should you find out you have a breast cancer. So the next one was, if I have a breast cancer, what do I do? And it was a discussion with the nurse navigator saying, this is what we do on our side. This is how you get into the system of the cancer center and the breast care team. And then I was able to talk about the different options for breast cancer, surgery options for breast cancer treatment. Again, sort of skimming along the top of doing lumpectomies versus mastectomies, and how do women decide what to do, and how I counsel people, including the need for radiation afterwards. And then Dr. Butterfield followed up with she called it breast reconstruction, the light at the end of the tunnel, which is what plastic surgeons will do, saying that yes, if you decide to do a mastectomy, what can she offer, or for oncoplastic breast reduction surgery. And then Dr. Rossi was here for the top 5 questions with radiation oncology. That was earlier this year. And was Dr. Kropp here with you?
Yeah. And Dr. Kropp, our new partner, Lauren Kropp, joined me in that conversation.
And then Dr. Donovan was here for her talk, was at least titled, Who Needs Chemotherapy or Hormone Blockers for Breast Cancer? Yeah. Again, goes into survivorship questions with the hormone blockers, which we will address briefly tonight. And then Kim, who's the genetic counselor here, last talk was last month in March, and talked about genetic testing and what the cancer center offers and provides.
Yeah, so kind of excited to have all these talks and the resources for you and your family members, friends in the future. I thought this whole series came together really nicely from my perspective.
Yeah, and it is, it's, as you probably figured out, we like talking about what we do. So yeah. That was good. So tonight we get to talk about survivorship and lifestyle recommendations. So again, the whole journey here, starting with getting mammograms, finding out there's a breast cancer, what to do, how to treat it, why we recommend what we do. And then this comes down to, okay, what's next? And so survivorship's a big part of that. And then also, I think both of us really thought about this as questions we get asked every day, like, survivorship, how do I live now? But then also lifestyle. And so the lifestyle, you don't have to have a breast cancer to be wondering about what lifestyle changes you can make or what we would recommend to reduce the chance of having to meet us here at Valley View. So,
Yeah, we want this to be a conversation. We're just going to talk about these questions we put together, but use the question and answer button, raise your hand. We'll interrupt and answer your questions. We don't want to just talk at you. We don't have to wait till the end to address those things, but we're going to separate this into first survivorship. And that's not from just the perspective of the breast cancer survivor. It's what can where's the family's role? What does anybody need to know? And then into lifestyle. Yeah.
good. And we haven't really rehearsed this, so we'll make this up. You can.
Yeah. So I guess why don't I start? I'll ask you a question. And so commonly people they go through the journey and then they're done. And so a question we commonly get asked is, how do I move forward? This is such a huge episode in their life, what comes next, but how do I move forward? And what's your answer to that?
And I think the really lovely thing about that, and specifically the Callaway Young Cancer Center, it's not just a question that I have to answer. I can say, yes, you certainly acknowledge that, yes, it's a lot you've been through, but also as women go through a journey with breast cancer or their family does also, you have a whole team. It's you've met a radiologist doing the mammogram, surgery, radiation, maybe medical oncology, and then there's the nurses, the nurse navigators, the integrative health people. So it's something to acknowledge, but also something to realize that we are used to that, and we're well accustomed to helping you negotiate the transition to make life as normal as it can be afterwards.
Yeah, absolutely. Yeah, I think it's important to know that there is a plan. If you ask us, so what's the plan? Sometimes our mind is, well, the next time I see you is for this, but really we have a 5, 10, 20-year plan for you, and it involves the team you started with. You'll always have a surgeon, and you'll always have a radiation oncologist if you need one, always have a medical oncologist, and kind of under our umbrella is physical therapy, it's integrative therapy. These are all important for your survivorship, and it doesn't stop on the last day of treatment. We will want to see you really probably too much,
Wow.
But it is important to continue. We do frequent radiographic imaging, we do frequent exams. We're just seeing, how are you doing and what are you dealing with and how can we address those issues? So it doesn't stop on the last day of treatment. I think that's really important. So if people, we don't want to, some people feel abandoned because they've been doing so much and they have had such a tight schedule and they've been balancing so much. You get a break, but it doesn't mean that our care of you ends whatsoever.
I think that's really important. Because a lot of women finish with radiation and there's a big party and celebration, and the department does a great job congratulating someone when they're done.
Yeah.
But then they go out to the car and go, okay, so now what? So we've got the now what. It's office visits, it's mammograms. It seems like too much at first, but as soon as you don't need it as much, we're not following as much. So it really, I think, works out great.
And we don't want you to actually go out to the car and feel like that. We have discharge instructions, you'll have appointments, we'll have talked about it, but it is like that. And that's what we call survivorship. And there's even official, survivorship meetings that will be offered just to sit down and say, how does this fit in to the rest of my life? And that's what we're here for.
Yeah.
Oops, I'm just making sure that's clicking on. So I get this question every day because I'm a radiation oncologist. I don't prescribe endocrine therapy like Dr. Brew does, like Dr. Donovan, Dr. Mayer do. But patients say to me, okay, next is the pill. What should I be thinking about? What should I be looking out for? How will this affect me? And it's a question we get every day. It's normal. We're here for that. We don't just get pills and expect to have zero conversation. So what do you tell people?
I think it's interesting because so many women put their head down and go about surgery. They don't get to, certainly worry about it, but it's something you have to do. Radiation, same thing. But I think the pills, you always get to that. It's like, oh my gosh, this is something that I can't imagine what it's like. And again, there's a lot of information out there that these are the anti-estrogen pills or the estrogen blockers. That if you start reading on blogs, it sounds like you're really doing the worst thing you possibly can to yourself. But I think the vast majority of women do great. And it does that sort of bridge to I'm still doing something every day. But I'd say for my conversations, we spend a lot of time, especially in the first 6 months, kind of sorting that out, figuring out whether side effects are related to the stress of treatment and everything else, or whether it really is the pill that's making them tired or achy or gain weight or whatever. So.
Yeah, absolutely. I think, what you do, it's very finite. You take out the tumor and you get negative margins. You can prove that to somebody. This is the benefit. And actually the biggest benefit is in surgery. And with radiation, there's a beginning and end within a few weeks, and you're done. But with the pill, it's more of a daily thing that you have to convince yourself I'm doing this and I know why I'm doing this. I have 5 years of it. And it's something that I think people get, but we're sensitive to is pills affect everybody differently. There's this heterogeneity, and it's probably in your genetics and stuff, just like menopause. Everybody may have a different experience. We can describe it to you, but some people may have very mild menopause symptoms for natural menopause, and some people, holy cow, it really changes their lives. And a lot of people fall out in between, and these pills kind of have menopausal type symptoms, perhaps. It could be arthritis, it could be this or that, and we can tinker with it. If you're not feeling right and we think it's the pill, we can change it, stop it, think about it a different way. We can mitigate your side effects in other ways too, say acupuncture or integrative therapy, massage, exercise.
And I think it's like so many things, it's the attitude too. I think some women go, I just don't want to do it. It's like, no, you should be so glad you can do this because it's still keeping you, you're still treating a breast cancer, making sure it's not coming back.
Yeah, absolutely. It's all completely evidence-based without its issues, but it does reduce risk.
Right.
And that's what we want to see.
So another good survivorship question that I get a lot is, how do I know I'm okay? Isn't there a blood test? Isn't there a PSA? Like my husband gets PSA to check for his prostate cancer, or what about the, PET CT scans? I mean, those will show me if cancer's come back, right?
Yeah, it's a difficult one. A lot of, just on our side, we've done a lot of imaging studies, and we follow, so just talking about imaging in particular, we have an imaging plan for every survivor. The basis of it is a mammogram because that works, and mammogram technology has gotten better and better, and maybe we should come back to that. But the other thing there isn't a perfect blood test. That's why we want to see you. We want to see how you're feeling. We're supposed to be trying to help you figure this out as well. We've done a lot of imaging studies, PET imaging, CT imaging. It just doesn't work, and so you're going to miss more than you capture. You're going to expose people to X-rays and stuff like that we don't want to do. So it's I mean, what we go about is thoughtful, it's evidence-based, but it isn't simple. We can risk adjust it though. I think that's important too, because we know if you had a 1 centimeter tumor to begin with, and we know if you've done X, Y, and Z, we know what your risk of recurrence is. And that's what we have in the back of our mind every time we see a survivor, whether it's a super high risk or super low risk. So we can kind of, that's part of what we bring to the table is we know the patterns on average of where it may come back. That's why we do breast exams and we check the other breast every time you come in. We check the lymph nodes. And those are kind of obvious things, but that actually works.
Yeah, and that's why telehealth doesn't really work for breast cancer follow-up. But I 100% agree that mammograms are absolutely the mainstay of follow-up. And I do get asked about MRI scans a lot because you can read about MRI scans. They seem like they're going to be so much better for follow-up than mammograms. But again, it can give us too much information. It can give us not the information we need. So most women, again, we use science for this, and there's no scientific benefit for most women to do MRIs, and it costs a lot of money. And
well, it's interesting. I get this question. There's a lot of women that the MRI saved their life. And when we have difficulty in diagnosis, maybe, we don't know, we think the mammogram is maybe a little bit bad, but we're not convinced. Ultrasound and MRI is something we use. And for that cancer at that time, the MRI was perfect. And we loved the result it gave us. However, when you're a survivor, we're not looking for that cancer. We're looking for breast cancer and all breast cancer. And a mammogram and mammogram technology, ultrasound technology has improved. And so we're very comfortable with mammogram-based screening. And it is, in our profession, we have decided that's better than MRI. But we still use MRIs. For instance, what's a patient you'll follow with an MRI?
So if someone, the women that it's really proven should be benefit, or at least scientifically beneficial, women who have a genetic mutation. So they have such a high risk of getting a breast cancer. I will often alternate. And these aren't breast cancer survivors. These are women who just have a high risk. And so I'll alternate mammograms and MRI scans. I do follow some women. I try to do every other year MRI scans. If their cancer really didn't show up on mammogram, it gives me confidence also that if something else were to show up, it would show up on MRI.
Yeah, there's some histology, as we say, which is how it looks under the microscope, that are more detectable on some imaging than other. But we're very consistent about this. We just don't make it up patient to patient. We'll have a plan from the very beginning on how you'll be followed. And if MRI was important at the beginning, for a couple of reasons, it's going to always be a part of your survivorship. It's just not the only thing we do. And exam is really important.
Exam's important. And I have also added, and this is not as relevant right after breast cancer surgery, but I have also really liked automated breast ultrasound, for women who have dense breast tissue. And now the FDA for a while has had to tell women about their breast density. And now I think it's coming out in a letter much more clearly since January. So a lot of women are coming in and saying, boy, I have dense breast tissue. What should I do?
Yeah.
And so the automated breast ultrasound, which we were talking earlier, they do a great job with it here. And I've had several patients that their mammograms were totally fine and the breast ultrasound showed the breast cancer. So
yeah, that's where you say, well, that's just ultrasound. Well, it's ultrasound in 2023. It's automated. It's essentially robotic. There's a lot of crazy software behind it, AI that helps us read it. And it's better than an MRI for women. And in a lot of circumstances. And
it's much less expensive, and you don't get a gadolinium injected. And
just a couple minutes. Yeah.
Could you also just comment? We just had a question come through. What about women who have had a mastectomy and imaging for them?
Yeah.
Repeat.
I'm going to repeat the question. I didn't interrupt. Yeah, I'm sorry, Betsy. The question is: once you've had a mastectomy, how do you follow a woman?
And I love that. I mean, a lot of women choose to do mastectomies because some women don't have a choice, but the advantage of it is that you don't need to get mammograms. There's no breast tissue left. You don't need to get ultrasounds. That breast exam is so important because if anything happens, I will say it's like a little nubbin on the skin. It's like a little bug bite that doesn't go away. It's a little rash on the skin, and it's a clinical exam.
Yep.
So
I think you're still you still have a plan.
Yeah.
For surveillance and
Right.
prevention.
right,
It's just different and but with no mammograms.
right. And breast exam is, or mastectomy exams are really important.
It's really important.
So,
So, here's a question. So patients finish up treatment, maybe come in the first time, they're free of disease, they're a survivor. They say, what can I do? What can I do with my experience? How can I help other people?
And that to me, at that point, women know so much. They've gotten the language, they figured out why we do what we do.
Yeah.
And every woman has an opportunity to help someone else. It takes time to figure out how you're going to do that or when you're going to do that. But your experience is so much more important, when you talk to other women than what we say. We can say until, oh, you'll be fine, you'll be fine, surgery will be fine, radiation's, easy, it's fine. But hearing it from someone who's been through it is so much better. And there's a real, unfortunately, there's a real network out there.
Yeah,
So,
absolutely. I think people keep each other on track for these prevention, the lifestyle, but also, have you seen your doctor?
Right,
When was the last time you had an exam?
Right.
That's important,
right.
pick on your
About
friend.
your mammogram.
We know friends, we know that in cancer survival, people that have a network, have friendships, are connected, they have better survival. And it's because people are picking on them and asking them these questions. People that are alone and isolated, that doesn't happen as much. And that's what we.
And I say every time someone's been diagnosed, they turn around and it's their neighbor or the woman they see in church every weekend. I mean, there are times to share that experience.
Absolutely.
This is my question to you, because I get asked this a lot. How do I know if I'm a cancer survivor?
You are. And there's no reason to think otherwise until we know something differently. We are always looking for, what may be around the corner or, bad news and stuff like that. For the most part, for most women, you're a survivor today and you're going to survive a long time. So you have to think about what you're going to, life beyond the end of treatment.
It's an interesting
your
label.
thoughts.
It's an interesting label, but I do think I think you're a survivor the minute you find out you have the cancer, no matter what it is, whether it's prostate or lung or colon, you're a survivor. So
No, I mean, we hope to be at that point where we have a meaningful intervention and that you can realize life after that. And that's true. People don't like labels. I mean, I know that people don't say, well, I don't want to be called a survivor. That's fine. But a lot of people do. And I want you to, we do want you to realize survivorship and, live in the moment that you are free of disease, because that does happen.
Right. And actively survive.
Yeah.
Yeah.
So.
Okay, now we're gonna do lifestyle.
Yeah.
And that probably applies to more people than breast cancer survivorship.
This is the section on, where, women may sit down with us and they say, well, this is what I've heard. Or,
This is what I saw on TikTok.
yeah, this is what I saw on TikTok, or my friend told me, and all these questions are legitimate. We want to hear them. There's never a bad question, especially, in our world. And so we want to hear about it. So here's one.
I'm gonna ask you.
Okay, ask me.
So I get a lot of questions about alcohol.
Yeah.
Is it okay? I really like having a glass of wine occasionally.
Yeah.
Is that okay?
Yes. Betsy, you can have a glass of wine occasionally. So it's a really good question, because alcohol is associated with increased risk of cancer, increased risk of cancer recurrence after treatment. There's no doubt about that. We, in most docs, have come to the conclusion through a lot of epidemiologic data and a lot of disease sites that probably 0 is a good answer, but let's be realistic. Social drinking is okay, and that's not the problem. Whether it's a glass a day or 2 glasses a day, talk to your doctor about it. We encourage moderation. We do know when you go up beyond 3 or 4 glasses a day, it increased the risk of cancer recurrence without a doubt. And that's it. We want to inform you of that. We're not picking on you. The mechanism is, alcohol affects so many things. I mean, we all know it affects your skin, your hair, it affects what you eat and how you go about other things, your ability to exercise. It increases inflammation, it decreases your immune system. Voila, your body does not fight cancer as well. There's themes out there, but at the same time, moderation is just fine. And, one drink occasionally, is perfectly okay.
Okay, so my next one, what about sugar? Can I still have a chocolate chip cookie occasionally?
Yeah, well, and the answer there is yes. And I think there's a lot of myths around sugar, they're propagated a couple different ways. One is we use sugar to find cancer. And if you don't know about that, that's fine. But one of the ways we find cancer in the body, because cancer is more metabolically active, when we inject sugar into you, we can detect where it goes. And that's how we find what's involved with breast cancer when it's locally advanced or advanced to begin with. But that doesn't mean sugar directly is causing cancer. And sugar is carbohydrates. It's a part of our diet. We just kind of breaking from that a moment. We really don't like refined sugar. We don't like fructose. Those are words that come up more and more right now for a lot of things in the American diet. It promotes diabetes, it promotes obesity, and it promotes cancer. But it's not about that chocolate chip cookie. It's not about splurging on some wedding cake at a special event. It's not about that at all. It's more about the whole picture. I think I always recommend it's that we do like the plant-based diet. We like complex carbohydrates. We don't like fructose or straight up sugar. But if you're just getting just a little thimble in your coffee or tea, and that's what you enjoy, that's perfectly all right with me. It's not a direct correlation whatsoever. It's more about the whole picture. Yeah.
And so I think you started saying that a little bit, that just from a diet perspective, there's no really right or wrong answer. But the more you stay away, this is whole body stuff. This is not breast cancer. The more you stay away from the processed foods, the more I've read, the more you shop the edges of the grocery store. You go to produce, and you go to the things you can identify and skip the middle with all the additives. That's good for you.
Yeah, it's difficult to talk about diet because diet is everything under the sun, right? And there's a million books on it.
Yeah.
But a lot of the prevention studies that we did in the 70s, 80s, 90s, 20-year mature data showed that the least processed diet, what used to be referred to as the Mediterranean diet, but kind of a least processed diet, a plant-based diet, that doesn't mean no meat. It doesn't mean enjoying what you like to enjoy, but it's in moderation and kind of focusing on that side of it definitely prevents cancer and prevents cancer recurrence, and especially in hormone mediated cancers like prostate cancer, breast cancer, lung, colon, ovarian cancer. Those things it's really important. So, and it's never too late to start. Just because you haven't that's not your style, it doesn't mean that you don't get the benefit integrating it now.
And I think the integration part is huge. It's not like you have to go from what feels like normal eating and then all of a sudden go, oh gosh, all I'm going to do is eat, kale, for instance.
Yeah.
That you can pay attention, I think is probably the
thing. And just eating kale isn't a good idea either. It's never going to be one thing that solves a good diet. Just one thing of this balances everything out. That's not it.
That goes to my TikTok question that I got yesterday. So the TikTok, it was my medical assistant actually in Denver, who said, I saw on TikTok yesterday, if I eat a lot of broccoli, my estrogen will be flushed from my system. So that goes to your point that eating a lot of anything's
Yeah.
probably not.
And linking broccoli to estrogen is really
Yeah.
hard. But broccoli's a good one. We like these cruciferous vegetables. Broccoli is definitely the good one, and a couple cups of things like that a day, integrating that into your diet is definitely a positive move. But thinking like flushing yourself with one, no,
It's not gonna happen.
and your body doesn't like things that way. I mean, and we can talk about supplements like that, taking a ton of supplements, with water, your body doesn't even know what to do with that. We've studied hundreds of supplements, and again, it goes back to, hey, Julia, oh, I'm not signed out. I thought I signed out for a second there. Sorry. It's your body doesn't manage it that way. It wants it in a whole diet. It wants this whole food diet. Broccoli is best processed whole with other foods, and that's where you get these great vitamin Bs. If you take vitamin B, your body actually just eliminates it right away, and that's a problem, because if you're just relying on a food replacement or a supplement, or you're not getting it.
Right.
You're
You're
that's
spending
not
money.
healthiness.
Yeah.
You're spending a lot of money. What to take a healthy a cup of broccoli costs maybe 20 cents. To process that and put it in a pill, it costs 2,000 times as much by the time you consume it from Amazon. And that's not, not only does body doesn't want it, that doesn't make sense.
Yeah, that's a great point. And so what is the easiest lifestyle change I can make? You told me I can still have my chocolate chip cookie. I can still have
Yeah.
an occasional glass of wine.
Usually the answer is usually it's what we talk about but don't do, and usually there's a little tension in the room when this comes down, because maybe someone found out, maybe someone has already attached to the Mediterranean diet or a plant-based diet, and it just hasn't been completely taken up or agreed upon by everybody in the room. But to me, I just say open up the front door and walk a couple times a day, most days of the week, and that is huge. Your body knows the difference. And
Yeah, I mean, that's what I tell people, all the studies being done to look at, what you can do lifestyle wise. And this is really reducing the risk of breast cancer.
absolutely.
Exercise. And I think the bar is low for exercise.
Yeah.
It really varies. And certainly this community, there's some exercise fiends out there, but for people who don't, it's getting up and moving. Like you
Yeah,
say,
it's
it's getting off the couch.
Yeah. You look at it both ways. So people will say to me, well, if I'm not running 10 miles, I'm not doing anything. And that's nonsense. It just is. And you have to find something you enjoy to do and do it until you're 102. That's what I say. And that's, for me, that's opening up the front door and going on a walk with my family, with my dog. That's deliberate activity, and your body does know the difference. We're able to show inflammatory markers go down just in 8 minutes or 10 minutes and stuff like that. So that's, you don't need to run 10 miles and hit a PR to help to reduce your risk. And then on the other side of that, believing that, well, I'm just walking for 8 minutes or 10 minutes, that's nothing. And, that's wrong too, because it does matter.
It makes a huge,
Yeah.
and it is, I mean, certainly we're talking about breast cancer issues, but from a heart
Oh, yeah.
disease standpoint, lung disease, and just getting the weight off.
Yeah.
Helps.
And with some people, we always set these bars, right? We're doctors, we're supposed to set bars. Well, I want you to do 4 hours a week, but break it down and fit it to your lifestyle. We're always going to kind of set that bar, and we're not picking on you. We know it's difficult. We all have busy lives. We're all active all day long every way, but it's also taking time for yourself and doing something that's meaningful for yourself, for your body. I think that's really important.
It's hard on a day like today.
Oh, I
So,
know.
it's like, but as spring comes, I always love spring, because people who haven't really felt like they could get out and move and, are intimidated by the winter or tired of the winter.
Yeah.
It's really nice because you can go out and look at the neighborhood and see what's turning green and what flowers are coming in.
A lot to look forward to. watching the snow fall outside.
So
Yeah, so
those were sort of the questions we had for each other.
the common questions that come up in
Yeah.
survivorship and conversations, like when we have nothing better to tell you, we kind of focus on those things.
Yeah. Yeah.
And
And it's not, I mean, there's not it goes beyond, there's certainly science involved, but a lot of it is lifestyle and how you live life and how you move forward.
Great. We had a lot of thank yous. This was very helpful. Two other questions that just came in, and feel free to remind everyone to send questions in if they have any more. Any supplements that you would recommend?
Okay, so that question is right back into you.
Yeah.
Any supplements that you would recommend?
So question, it's interesting. Supplements are very, we study them. And even, we've studied supplements just to help with common side effects of radiation, like fatigue. Why does it happen? Why can't we measure it? It's not because you're anemic. It's not as easy as that to show low blood cells and, oh, you're anemic, that's the radiation. You just, if you take iron, it will be better. I mean, it's not as easy as that. And we've studied supplement. We know that we're causing inflammatory markers to go up. And we know that there's a mental and physical part of being really tired with radiation and hanging over your head every day. But there's a physical part because the inflammatory, but we don't have, we've studied CoQ10, a lot of different things. It's, a solid diet, a plant-based diet, a good night of sleep, avoiding alcohol, actually in activity. Don't sit on the couch, be engaged, rejoin your society, your people. I mean, those things go a long ways to get, go against that fatigue. And a lot of things, supplements have been really studied to find very little value. In fact, a lot of harm, just to be honest. And we know a lot about that. In fact, our integrative therapists are really wonderful, and they'll look through the list of things you may not tell me about and just say, hey, we're concerned about this or that. There are certain things, of course, in addition to a plant-based diet, we do support kind of lower doses than you may find at City Market of vitamin D, perhaps calcium for bone health. I talk about turmeric and curcumin as an anti-inflammatory.
I talk about magnesium
Oh,
to
absolutely.
help with sleep
Sleep.
and hot flashes.
Yeah,
So,
if people kind of have a little bit of a lull in that in their
Yeah.
diet. I talk about lycopene, which is really just in tomatoes. And it's a part of the Mediterranean diet that's been, when you shake the box and really look at what people are eating, diets high in tomatoes, some cancers have been benefited by that. And sometimes it's hard to get a lot of tomatoes. So lycopene is what we link it to. It's like, if you haven't heard about lycopene, it's vitamin A. It's like vitamin A. It's a sister analog. It's not essential mineral or vitamins, but it's in our diet in many things. But
so do you take supplements?
no, no, I 2 cups of vegetables a day.
Yeah.
I'm a lean and green, meaning, I enjoy meat and I enjoy, salad a couple times a day or lots of colors and greens and stuff. That's what I think works best for me and my family today. No supplements. How about
I
you?
take vitamin D.
Mhm.
I think a lot of women after menopause take vitamin D.
Yeah.
So,
I think and that's great.
Yeah.
Great. I have one more for you. Do I really need to exercise vigorously to get the benefit?
no, I love the way that Pete says this. You just have to open the door and walk outside.
The question was, do I have
Yes,
to
sir.
exercise vigorously? I'm sure you heard Sarah, and the vigorously part is what we're trying to.
Right. And I think
Erase.
part of it is being in the Roaring Fork Valley where you look around and there's people out, riding their bike for 200 miles and you think, wow, that's exercise, but that's not what we're talking about.
They're not only doing that, they're telling you all about it.
Yeah, you can do that.
So I'm just kidding. But no, it's opening up your front door and just whatever, that's why I like walking, and not everybody can walk, but swimming's awesome. You have the community centers here that, there's pools in the community centers, there's the hot springs. It's not about the vigorousness of the activity, it's about activity. Your body knows the difference. I guarantee you, I can show you that.
Great. Thank you. Those are all the questions, but maybe just wrap it up and let people know if they have further questions. We're here and
Yeah, so I think there's two things. If there's a question that you really want to have answered, that we didn't get to, or you weren't quick enough on the Q&A, you can get an emailed response, right? They will look at it here and then send a response back. And then there will be a survey, so you can fill that out if there's any topics that we didn't cover, although this is 9 of 9 for right now for breast care, so we'll have to come back and do it again. And then there is the link, and so certainly not just to this, but for the previous talks or webinars, the links are out there.